Practitioners, Pharmacists and Dentists Union is decrying what it terms as a low budgetary allocation to the health sector. In the 2022-2023 budget, National Treasury Secretary, Cabinet Secretary rather, Ambassador Ukur Yatani allocated 146.8 billion shillings to the health sector, the biggest share ever. But KMPDU says the amount translates to only 4.4% of the total budget, which they say is a raw deal. Purity Museo reports.
On April 27, 2001, African governments made a historic pledge to allocate at least 15% of their annual budgets to the health sector. This vow became known as Abuja Declaration. Kenya is among countries yet to implement the declaration, as evident during the 2022-2023 budget reading last Thursday.
I propose to allocate shilling 146.8 billion to the healthcare sector to support the various programs aimed at improving healthcare outcomes.
Although National Treasury Cabinet Secretary Ambassador Ukur Yatani termed it the biggest allocation ever to the sector, this amount only represents 4.4% of the total budget and less than what was given last year.
The overall budget is low. And even if you look at the aspect to implement the UHC, when you say you want to implement UHC as 62 billion, and we know that UHC encompasses equipment, it encompasses governance, it encompasses the human resource aspect of it, which has not all been mentioned, then it is just a fallacy.
Kenya Medical Practitioners, Pharmacists and Dentists Union further accuses county governments of disregarding the welfare of health workers in the country, citing failure to pay medics on time.
Out of the health budget, about 56% of it goes to the Ministry of Health, which then do not have employees, but then deals directly with training and policy. But despite that, the Ministry of Health has gone against its mandate that has been having. It has been citing a budgetary deficiency in handling some of the important issues in training.
If the next pandemic gets us with a budget of 7 billion, while in the same budget you have allocated 87 billion shillings to stalled projects, white elephants, then there's a problem with this country. It's a lopsided allocation.
The doctors are threatening to mobilize nationwide demonstrations beginning May if the government fails to heed to their cry.
We are calling the Council of Governors to stand together with the unions to demand for the increase of funds to the counties, because we are going to see a situation whereby the doctors, the healthcare workers, the nurses are not being employed. So the public will actually not see any changes in the healthcare.
When the country reported the COVID-19 outbreak months into the pandemic, we witnessed industrial action from the healthcare workers, and their cry was they did not have enough support and equipment to stay at the front line. Now, today, issuing threats that they will start demonstrations if the budget allocation is not improved for the healthcare workers. Will the government hear their cry? Purity Museo, The Legends Edition, Nairobi.